Does the mind have the power to cure? The idea that the mind has the power to cure is a topic that bridges psychology, medicine, philosophy, and spirituality. Many believe that the mind has a significant influence over the body's ability to heal, often through mechanisms like the placebo effect, meditation, and positive thinking. From a scientific perspective, the connection between the mind and the body's ability to heal is well established, with various fields of research providing insight into how mental and emotional states can influence physical health. Here are some key scientific concepts that explore the mind's influence on healing. 1. Placebo effect. The placebo effect is one of the most compelling demonstrations of the mind's ability to influence physical health. When a patient believes they are receiving treatment, whether it's a sugar pill or an inactive substance, their symptoms often improve, even if no active medical treatment is involved. This effect shows that the mind's belief in healing can trigger real physiological responses, such as the release of endorphins, which can reduce pain, or improvements in immune function. 2. Psychoneuroimmunology, PNI. Psychoneuroimmunology is the study of how the mind, psychological factors, the nervous system, and the immune system interact. Research in this field has demonstrated that psychological stress, emotions, and mental states can affect immune function and influence the body's response to illness. For example, chronic stress can suppress the immune system, making the body more vulnerable to infections, while positive emotional states and reduced stress levels can enhance immune function and promote healing. 3. The role of stress. Stress is a key factor in the mind-body connection. The fight-or-flight response, triggered by stress, releases hormones like cortisol and adrenaline. While these hormones are useful in short bursts, e.g., when reacting to danger, chronic stress can lead to harmful health effects, including weakened immune function, increased inflammation, and higher risk for cardiovascular disease. Conversely, practices like relaxation techniques, yoga, and meditation have been shown to reduce stress, lowering levels of cortisol and improving overall health. 4. Mindfulness and meditation. Mindfulness practices and meditation have gained considerable attention for their ability to reduce stress, improve mood, and contribute to overall well-being. Studies show that regular meditation can affect brain activity and structure, leading to changes in areas associated with emotional regulation, attention, and stress management. Meditation can also improve the body's ability to cope with pain, lower blood pressure, and support a healthier immune response. 5. Psychological resilience and healing. People with high psychological resilience, those who can effectively cope with stress and adversity, often have better health outcomes, even in the face of serious illnesses. Studies have shown that people with a positive outlook, strong social support, and effective coping mechanisms tend to recover more quickly from illnesses and injuries. The mind's ability to stay hopeful and engaged can influence recovery by boosting immune function, reducing the perception of pain, and even improving the body's response to medical treatments. 6. Biofeedback and neurofeedback. Biofeedback and neurofeedback are therapeutic techniques that teach individuals to control physiological functions such as heart rate, muscle tension, and brain waves. By using sensors that provide real-time data about bodily functions, patients can learn to influence these functions consciously, which can help manage pain, reduce anxiety, and improve other aspects of health. 7. The gut-brain connection. There is growing recognition of the gut-brain axis, the bidirectional communication between the brain and the digestive system. The gut contains a large number of neurons and is sensitive to emotions and mental states. Research suggests that psychological states like stress and anxiety can affect gut health, while maintaining a healthy gut microbiome can positively influence mental health. This interaction highlights the interconnectedness of the mind and body in maintaining overall well-being. 8. Impact on chronic illnesses. Chronic conditions such as heart disease, diabetes, and chronic pain can be significantly influenced by mental health. Conditions like depression and anxiety are often linked with poorer health outcomes in patients with chronic illnesses. Conversely, positive mental health practices, such as social support, optimism, and engaging in activities that promote well-being, can improve the quality of life and potentially reduce the severity of symptoms in chronic disease management. Conclusion. The scientific perspective confirms that the mind plays an important role in influencing health and healing, with extensive evidence supporting the idea that psychological states, stress management, and belief systems can impact physical outcomes. While mental processes can't replace medical treatment for all conditions, they are a crucial factor in the healing process, especially when it comes to supporting the body's natural ability to recover, manage symptoms, and improve overall health. This underscores the importance of integrating mental and physical health for optimal well-being. Psychological healing refers to the process by which individuals work through emotional, mental, or psychological difficulties to improve their well-being. It involves addressing underlying thought patterns, emotional responses, and behaviors that may contribute to distress. Psychological healing can be crucial in overcoming trauma, chronic stress, depression, anxiety, and other mental health challenges, often leading to physical healing as well due to the mind-body connection. Here are several psychological techniques and approaches that are commonly used to promote healing. 1. Cognitive behavioral therapy, CBT. CBT is one of the most widely practiced and evidence-based psychological therapies. It focuses on identifying and changing negative thought patterns and behaviors that contribute to mental distress. For example, someone with anxiety may learn to challenge catastrophic thoughts and replace them with more realistic, balanced thinking. CBT can help individuals manage conditions such as anxiety, depression, and chronic pain, often leading to improved emotional regulation, better coping strategies, and enhanced quality of life. 2. Mindfulness-based therapy. Mindfulness is the practice of staying present in the moment without judgment. Mindfulness-based therapies, such as mindfulness-based stress reduction, MBSR, or mindfulness-based cognitive therapy, MBCT, have been shown to be effective in reducing symptoms of anxiety, depression, and stress. These approaches teach individuals to observe their thoughts and emotions without becoming overwhelmed or reactive, allowing for more conscious responses to challenging situations. Research has shown that mindfulness practices can lead to lasting changes in brain activity, helping people regulate their emotions and reduce the impact of negative thoughts. 3. Trauma-informed therapy. Trauma-informed therapy is a therapeutic approach that recognizes and addresses the impact of trauma on an individual's mental and emotional well-being. This approach is particularly beneficial for people who have experienced abuse, neglect, or other forms of psychological or physical trauma. It emphasizes creating a safe, supportive environment where individuals can process their experiences, develop coping mechanisms, and work toward emotional recovery. Techniques such as EMDR, eye movement desensitization and reprocessing, and somatic therapies can help individuals process traumatic memories and emotions, reducing their negative impact on health and well-being. 4. Acceptance and commitment therapy, ACT. ACT is a form of therapy that focuses on accepting difficult thoughts and emotions rather than fighting against them. The core concept of ACT is psychological flexibility, which involves recognizing and accepting difficult experiences while remaining committed to behaviors aligned with one's values. For example, someone who experiences chronic pain might learn to focus on living a meaningful life despite the discomfort, rather than becoming consumed by the pain itself. Research has shown that ACT can help with anxiety, depression, and pain management by promoting greater psychological resilience and well-being. 5. Positive psychology. Positive psychology focuses on enhancing well-being by emphasizing strengths, positive emotions, and personal growth. Instead of focusing on treating pathology or symptoms, positive psychology encourages individuals to cultivate gratitude, optimism, and resilience. Techniques in positive psychology include activities such as keeping a gratitude journal, practicing acts of kindness, and developing positive self-talk. Research has found that fostering positive emotions and attitudes can improve mental health, boost immune function, and increase overall life satisfaction. 6. Emotional freedom technique, EFT/tapping. EFT, also known as tapping, combines elements of cognitive therapy with acupressure. It involves tapping on specific points on the body while focusing on specific emotional issues, such as anxiety, trauma, or chronic pain. Proponents of EFT suggest that tapping can help clear emotional blockages and balance the body's energy, leading to emotional healing. While research on EFT is still developing, some studies suggest it can be effective in reducing symptoms of anxiety, PTSD, and stress. 7. Self-compassion practices. Self-compassion, popularized by psychologist Kristen Neff, involves treating oneself with the same kindness and understanding that one would offer a friend in times of difficulty. Self-compassion practices have been shown to improve emotional well-being, reduce self-criticism, and increase resilience in the face of stress and adversity. This approach encourages people to acknowledge their pain and imperfections without judgment, fostering a sense of inner peace and acceptance. 8. Expressive arts therapies. Expressive arts therapies, such as art therapy, music therapy, or dance/movement therapy, allow individuals to express emotions non-verbally through creative outlets. These forms of therapy can be particularly helpful for people who struggle to articulate their feelings, or those who have experienced trauma. Creative expression can provide an outlet for emotions, promote relaxation, and help process difficult experiences, all of which can contribute to healing. 9. Behavioral activation. Behavioral activation is a technique often used in the treatment of depression. It involves increasing engagement in activities that are rewarding or meaningful, even when an individual may not feel motivated to do so. By overcoming inertia and starting with small, manageable steps, individuals can begin to break the cycle of withdrawal and isolation, which can reinforce depressive symptoms. This approach can improve mood and increase feelings of accomplishment, leading to greater emotional resilience. 10. Social support and connection. Psychological healing is often facilitated by strong social support and connection with others. Having supportive relationships, whether with family, friends, or a support group, can reduce feelings of isolation, alleviate stress, and promote emotional healing. The presence of empathetic listeners and people who provide practical and emotional support can enhance an individual's coping ability, increase feelings of safety, and promote a sense of belonging, all of which contribute to healing. Conclusion. Psychological healing involves a variety of techniques and approaches designed to help individuals process difficult emotions, cope with stress, and enhance emotional resilience. Whether through therapeutic methods like CBT or mindfulness, or through the cultivation of self-compassion and social support, psychological healing helps individuals regain balance and well-being. As the mind and body are deeply connected, improving mental health can lead to better physical health outcomes, reducing symptoms of illness and contributing to overall well-being. Spiritual and philosophical views on the power of the mind to heal often emphasize the connection between the mind, body, and soul. These perspectives generally view healing as an integrative process that involves not only addressing physical symptoms but also nurturing the spirit, emotions, and consciousness. While different spiritual and philosophical traditions offer diverse approaches, they often share the belief that mental and emotional well-being are deeply connected to overall health, and that healing can occur when individuals align with higher truths, cultivate inner peace, or tap into spiritual resources. 1. Faith and belief in divine intervention. Many religious and spiritual traditions teach that faith, prayer, or divine intervention can promote healing. In these contexts, the power of the mind is often linked to the ability to tap into a higher consciousness or divine source. For example, Christianity often emphasizes the power of prayer and faith in God to heal. In the New Testament, there are numerous instances where individuals are healed through faith or by the divine touch of Jesus. The Bible also speaks of the mind's power in the context of hope, peace, and trusting in God's plan for healing, e.g., "Your faith has made you well," Matthew 9 verse 22. New Age spirituality teaches that the mind has the power to manifest healing through intention and visualization. Practices such as guided meditation or visualization techniques often emphasize aligning one's thoughts with a higher purpose or universal energy to attract healing. Indigenous healing practices often emphasize the interconnectedness of mind, body, and spirit. Healing rituals may involve invoking spiritual guides, ancestors, or natural forces to restore balance and harmony. These practices often focus on holistic healing, where emotional and spiritual wounds are seen as influencing physical health. 2. Mindfulness and presence in Eastern spiritual traditions. In many Eastern spiritual traditions, such as Buddhism, Hinduism, and Taoism, the mind is seen as a powerful tool for both healing and self-realization. These traditions emphasize the cultivation of mindfulness, inner peace, and balance as key to spiritual and physical well-being. Buddhism teaches that mental suffering, particularly attachment and desire, leads to physical and emotional suffering. Meditation practices such as Vipassana or Zazen encourage individuals to observe their thoughts and emotions without attachment, allowing them to clear the mind of negativity and attain a state of equanimity. By doing so, one is said to promote healing on both the mental and physical levels. In Hinduism, the concept of yoga is deeply tied to the mind's ability to influence health and spiritual growth. Pranayama, breathing techniques, asana, physical postures, and meditation are all believed to balance the energies within the body, align the mind, and promote healing. Ayurveda, the traditional system of healing in India, also emphasizes the mind-body connection, with treatments that include diet, lifestyle adjustments, and spiritual practices to restore balance. Taoism emphasizes living in harmony with the natural world and cultivating qi, life force energy. Practices such as Tai Chi and Qigong are designed to balance and move the energy within the body, promoting both spiritual and physical healing. The Taoist view suggests that the mind can guide and harmonize the flow of qi to enhance health. 3. The power of positive thinking in philosophical traditions. Many philosophical traditions explore the idea that the mind has the power to shape our reality, including our health. The core idea is that by changing one's thoughts and outlook on life, individuals can influence their experiences, well-being, and even physical health. Stoicism, a school of thought in ancient Greece, emphasizes the role of the mind in achieving peace and resilience in the face of hardship. Stoics like Epictetus and Marcus Aurelius taught that our mental and emotional responses to external events, whether joy, pain, or illness, are within our control. By cultivating inner peace and detachment from external circumstances, Stoics believe individuals can achieve emotional healing, regardless of their physical state. The power of positive thinking, popularized by figures like Norman Vincent Peale and William James, suggests that cultivating an optimistic mindset can have a profound effect on health. According to this philosophy, positive thoughts can influence the body's biochemical processes, reduce stress, and foster healing by encouraging a sense of hope and purpose. Existentialism, a philosophy that emphasizes individual choice and the search for meaning, suggests that healing can come through finding personal meaning and accepting responsibility for one's own life. By confronting the realities of suffering and accepting one's circumstances, individuals can heal psychologically and spiritually, even in the face of illness or hardship. 4. Healing through connection and love. Many spiritual and philosophical traditions emphasize the importance of love, compassion, and connection as powerful forces in healing. Love is often seen as the highest form of energy that can restore balance and bring about healing, both physically and emotionally. Christian mysticism and other mystical traditions often teach that divine love has a transformative power. The idea is that when individuals connect with divine love, whether through prayer, meditation, or service to others, this healing energy flows through them, healing not only the soul but also the body. A Course in Miracles, a spiritual text that emphasizes the power of love and forgiveness, teaches that healing occurs when individuals let go of fear and embrace love. It suggests that our minds have the power to choose love over fear, which leads to healing both in the mind and the body. The healing power of compassion, emphasized in many Buddhist and Hindu traditions, suggests that by cultivating compassion for oneself and others, individuals can promote emotional healing. Compassion-based meditation practices have been shown to reduce stress and promote well-being. 5. Holistic healing and interconnectedness. Many holistic traditions see the mind as an integral part of the body, not separate from it. These traditions often focus on the interconnectedness of the physical, mental, and spiritual dimensions of the person. Shamanism, practiced in various indigenous cultures, believes that spiritual imbalances or disruptions in the energy field can manifest as physical illness. Shamans work to restore spiritual harmony through rituals, prayers, and ceremonies, calling upon spirits or natural forces to heal the individual on all levels. Anthroposophical medicine, founded by Rudolf Steiner, is a holistic approach to healing that integrates spiritual science, the arts, and natural medicine. It believes that healing occurs when the mind, body, and soul are in harmony, and it encourages patients to develop spiritual and creative practices that foster well-being. Conclusion. Spiritual and philosophical views on the mind's power to heal emphasize a holistic approach to well-being that transcends the purely physical. These traditions often highlight the importance of faith, love, mindfulness, positive thinking, and spiritual connection as key factors in achieving health and healing. Whether through prayer, meditation, or cultivating positive mental states, these approaches recognize the profound influence the mind can have on the body's ability to recover, maintain balance, and achieve peace. Ultimately, the power of the mind in healing is not just about mental processes, but about nurturing the deeper connection between the mind, spirit, and body. While the mind has significant power to influence our well-being and facilitate healing, there are limitations to its influence. Not all physical or psychological conditions can be healed through mental processes alone. The mind may play a critical role in coping with or managing certain conditions, but it cannot replace medical intervention when it comes to certain diseases or injuries. Here are some of the main limitations of the mind's power to cure or heal. 1. Physical conditions beyond psychological control. Some illnesses, particularly acute or chronic physical conditions, require medical treatment that cannot be achieved through mental processes alone. For example, infections, conditions caused by bacteria, viruses, or fungi require specific medical treatments like antibiotics or antivirals to clear the infection. Cancer. While mental attitude and support can play a role in coping with cancer, the mind alone cannot cure it. Effective treatments such as surgery, chemotherapy, or radiation therapy are often necessary to fight the disease. Genetic disorders, conditions like Down syndrome or sickle cell anemia, which are caused by genetic mutations, cannot be cured by the mind alone. Genetic therapy and other medical interventions may offer solutions, but not purely mental effort. 2. Limitations of the placebo effect. The placebo effect, where a person experiences improvement in symptoms after receiving a treatment that has no active ingredients, demonstrates the mind's power to influence health. However, the placebo effect has limitations. It works primarily on subjective symptoms such as pain, fatigue, or mild anxiety, but it cannot address the underlying physical causes of illness. The placebo effect is often short-term and may not lead to a lasting cure for serious conditions. It depends heavily on the individual's belief in the treatment or the mind's ability to expect healing, which is not a guaranteed or consistent outcome. 3. Severe psychological conditions. Some severe mental health conditions, such as schizophrenia, bipolar disorder, or severe depression, cannot be fully cured through willpower, positive thinking, or mental strategies alone. These conditions often require a combination of medical treatment, such as medication, antidepressants, antipsychotics, to manage symptoms, therapeutic interventions like psychotherapy to help manage behaviors and emotions. While mental approaches can improve quality of life and aid in symptom management, they are usually not sufficient on their own to cure these complex conditions. 4. Trauma and deep emotional wounds. Emotional or psychological trauma, particularly from abuse, loss, or chronic stress, can have lasting impacts on mental and physical health. While the mind can play a role in managing these issues, deep-seated trauma may require more than just self-reflection or cognitive change. Healing often involves therapeutic support, such as trauma-focused therapy, e.g., EMDR or CPT, to process the trauma safely and healthily, support from mental health professionals and the social environment to rebuild trust, safety, and emotional resilience. While the mind can influence emotional healing, the process of resolving deep trauma is often a complex and ongoing journey that involves external support systems, medical interventions, and time. 5. Chronic pain and physical disabilities. While the mind can influence how we experience pain and may help us develop coping mechanisms, it cannot always eliminate chronic pain or reverse physical disabilities. Pain management techniques such as mindfulness, meditation, and cognitive behavioral therapy, CBT, can significantly help people manage chronic pain. But these methods often do not eliminate the underlying cause, e.g., arthritis, nerve damage. Disabilities caused by injury or congenital conditions often require long-term medical care, physical therapy, or assistive technologies to improve mobility or quality of life. While the mind can help someone adjust to their condition and cultivate a positive mindset, it cannot cure the disability itself. 6. The impact of external factors. The mind can only work within the context of external factors. For example, environmental influences such as pollution, poor diet, or exposure to toxins can significantly affect health. No matter how positive one's mindset or mental resilience, external factors like chronic exposure to environmental stressors or lack of medical access can prevent healing. Genetic predispositions and other biological factors can limit the effectiveness of the mind in healing. Even the most positive mindset cannot prevent genetic conditions or change one's biological predispositions. 7. Limitations in time and control. The mind is powerful, but it is not omnipotent. Time and control are significant factors. Healing from many illnesses or injuries takes time, and while the mind can aid in recovery, it cannot accelerate the biological processes of healing, e.g., cell regeneration, tissue repair. The mind can help manage chronic conditions, but often cannot fully cure them. For example, someone with chronic migraines may use mental techniques to reduce the frequency and intensity of the headaches, but they may not be able to eliminate them entirely without medical intervention. 8. Psychological healing is not immediate. Even when psychological healing does occur, it is rarely an immediate or complete process. The mind may help alleviate symptoms or improve coping, but healing emotional wounds can take years and may involve setbacks. For example, grief or the emotional aftermath of trauma cannot be cured simply by thinking positive thoughts or using mental strategies. It often requires long-term support and integration. Mental illnesses often have underlying biological or chemical factors that need to be addressed through medication, therapy, and lifestyle changes, in addition to mental healing efforts. Conclusion. While the mind is undeniably powerful in influencing both mental and physical health, its capacity to heal is not unlimited. It plays a crucial role in managing, coping, and supporting the body's natural healing processes, but it is not a substitute for medical intervention in the face of certain physical, psychological, or emotional conditions. Effective healing often requires a combination of the mind's power, medical treatment, therapeutic interventions, and external support. The mind can facilitate recovery, but its power to cure is best utilized when integrated with other forms of healing.